Welcome everybody, Andrew Holecek here. I'm really delighted to introduce you to Dr. Nevin Arora and spend the next hour or so with this remarkable individual talking to you all about some super practical infrastructure approaches to sleep and dream, which are obviously incredibly necessary for working with things like lucid dreaming altogether. So let me introduce you to Dr. Arora here. So Dr. Nevin Arora is a board certified psychiatrist and sleep medicine specialist. He completed his residency in psychiatry at Georgetown, followed by a sleep medicine fellowship at Stanford University. His interests focus on non-drug therapies for insomnia and other sleep disorders, including lucid dreaming as a potential intervention and framework for improving sleep and quality of life. So welcome, Nevin. Thank you so much for taking time out of your busy schedule to chat with us. And gosh, there's so much to talk about, to launch into here, but the main kind of gesture of this interview is somewhat in harmony with a kind of a classic maxim in the Buddhist tradition where they assert that the preliminaries are more important than the main practice. And if we're talking about the main practice in our schema being things like lucid dreaming, then the preliminaries start with having good sleep and the ability to really work with our dreams. And so what I want to spend this next hour or so with you about is talking about the extraordinary importance of sleep, its role in physical and psychological health. But before we jump into that, because that is obviously an enormous topic, I do want to start right up front, with your permission, with this really provocative aspect of your bio, where you talk about your inclusion of lucid dreaming as a potential intervention and framework for improving sleep and quality of life. So if it's okay, let's start with you riffing a little bit on that and how that has played out in your professional work, and also, if I might ask, how it's actually played out in your own personal life as a lucid dreamer. So how in fact do you use lucid dreaming as an intervention and framework?
Yeah. So no, well, thank you for having me, and great way to dive into it. I will tell you up front, my own personal lucid dreaming experience is probably not quite as expansive and rich as others who are listening, and others who really have incredible transformative experiences with that. In general, and just in the based on the work that I do, the clinical work I do with, which does specialize a lot in insomnia, there's just a need really to be able to offer some type of treatments that are a little bit more durable, and something that people can really keep with them for an extended period of time, which pharmaceutical drugs, while they can help, it's oftentimes doesn't give that durable benefit. So in general, when I think about lucid dreaming and just dreaming in general, this provides really a excellent avenue to explore oneself every night, potentially a few times a night, to be able to uh, transform the experience of not sleeping into something that can provide some more willful control, or a different respect on how to conceptualize the difficulty in sleeping. So much about insomnia is a person's perception of it, and their behaviors that surround their lack of sleep. And what I've found with lucid dreaming in the few couple of experiences that I've had with it, and in talking to others who really have had a really good practice with it, is that the experience of being awake at night and the experience of getting up in the morning can really become much more rich and fulfilling if we have this focus on which to build from. And obviously, with lucid dreaming, this becomes a focus that stays with us and is able to allow us, again, like I said, a different introspection into how we're living our life and what's coming to us in our sleep. I really appreciate what you said about the Buddhist maxim there about learning the and I'm sorry, I know you said it best there, but
Yeah.
how the beginners, you got to focus on the things at the very beginning there versus the end goal, which would be lucid dreaming. And I think the interesting that comes about that with sleep is the best sleepers out there are children, and people who have not necessarily been on this world for as long. Those are the best sleepers out there, and those are the people that have the most ability to lucid dream, I would say, in the sense of the REM sleep that's there. So I know I'm talking on a tangent here, but to get back to what you were saying about lucid dreaming as a foundation, or how to build upon there, it becomes something to where dreams and nightmares, oftentimes for people, this is something that comes to people whether they like it or not. And oftentimes, when I speak about nightmares, it's a very unpleasant experience, and this in and of itself can cause sleeping difficulties, difficulty during the daytime. And when we can think about how to work with a nightmare, or to be able to change the script of a nightmare, or to look at it in a different way, lo and behold, so many other things start to improve in the sense of a person's sleep quality, their daytime waking experiences, just being able to work through something or understand these, potentially horrific images, or themes that just visit every night. And while medications can certainly help to maybe dull that experience a little bit, I think the real treatment for a disorder like that is to be able to confront it, and to be able to work with it, and redefine that experience into something that can make it more of a holistic experience, or become one of ourself here, one with oneself. And with that type of integration, I mean, my goodness, the sky's the limit, really. And lucid dreaming, to me, from an intellectual standpoint, and as I said, from very minimal experiences of the ones that I've had, it really is. It's something to where I don't think our backs can be turned upon it. I think it's something we need to embrace. It's something we need to understand more, and to be able to do that, I think, is really going to help. Not only the person, but I think the clinician, or the provider, the therapist, the counselor, whoever have you, to understand a person as a whole and be able to treat a person as a whole.
Yeah, that's really interesting. And actually, if I'm understanding you, excuse me, it's really resonant with the charter and the theme of what we're doing with our little nightclub, and the members who are involved in it. And that is that, the larger scope, lucid dreaming obviously has a very specific kind of target. But if I'm grokking what you're saying, Nevin, it's really the larger scope of lucidity is really what we're talking about here. That yes, it's great if you can have lucid dreams and that sort of thing. But the larger scope is that by bringing a heightened sense of awareness to the nocturnal mind altogether, we can fundamentally change our relationship to sleep and dream, and work with obstacles and really transform them into opportunities. And for instance, you're referring to insomnia, which is, of course, of the 100 or so plus sleep disorders, is number one on the list. And I want to
Yeah,
come back and talk about that. But this is absolutely in resonance with my own experience before I actually started talking to sleep professionals. Is that armed with the skill set of lucid dreaming, that I've been able to transform my relationship to this otherwise really unwanted experience. And instead of, my little playful mantra here is, instead of "oh crap," it's "oh wow." Every night I
yeah,
have the opportunity to, here it is. There it is. I got to deal with it. And really, in a very deep way, meditation, as I've come to understand it altogether, is in fact about changing relationship to phenomenal experiences. And in that
mhm,
that's what this does. You have the nightmare, you have the inability to fall asleep, or whatever you're struggling with, and armed with the classic lucid dreaming armamentarium, and also the skill set that I want to tap your experience with a little bit more, we can transform this obstacle into opportunity by, in fact, transforming our relationship to it.
exactly. Yeah,
Yeah,
absolutely, Andrew. Yeah, you nail on the head. It's really exciting, actually, to think about just the potential this has, and how, and again, the work you're doing with the nightclub here and what you have, just how this is something that is more accessible to people if they have that interest, if they have that desire, that there are opportunities to do this. So really, it's really an exciting time, I think. And it's the sky's the limit, I would say, if we could really start to live our life and transform our sleep, not just our sleep state, but our wake state, into something that is a little bit more of a lucid living, something where we are more cognizant of the present moment, and able to gain mastery of our thoughts, and our, leading into that, our behaviors and our ability to sleep. So absolutely.
and what the other thing that it does for me, Nevin, is it alters my relationship to sleep and dream altogether. Because, as we both know, especially in the Western world, we have this somewhat dismissive relationship to sleep and dream. There's this popular saying, you snooze, you lose. Well, I think we can flip that on its head. If you don't snooze, you definitely lose. And if we don't have respect the power of sleep, I mean, it's really the infrastructure of how we live our lives, like you were
Yeah.
talking at the end. If we don't get the sleep that we need, and this is what I want to start to turn our lens towards, if we don't get the sleep that we need, our days are profoundly and adversely affected. And with your permission, I wanted to just read a tiny bit. This is actually from Matthew Walker's book.
Yeah.
Um,
Yeah. Excellent book.
yeah, where he really sums it up. And in fact, as I sit here at my desk, I've got what, 5, 6, 7 books over the last couple of years. You know, Ariana Huffington's book, the Sleep Revolution, The Mind at Night, Kat Duff's book, The Secret Life of Sleep, Matthew Walker's book. And to me, it's really thrilling that finally, in the popular press, people are starting to realize that this previously unhealthy relationship to sleep and dream is now being really contested by science and popularized by these authors, so that people realize that if in fact we don't sleep and dream properly, we're going to live profoundly affected, adversely affected lives, and in fact, we're going to live shorter. So let me just start by reading this one little thing from Matthew, and then let's unpack it a little bit, because whatever we can do to encourage our listeners to get the restorative rest they truly need, I think then our time will be extremely well spent. So this is what Matthew says: routinely sleeping less than 6 or 7 hours a night demolishes your immune system, more than doubling your risk of cancer. Insufficient sleep is a key lifestyle factor determining whether or not you will develop Alzheimer's disease. Inadequate sleep, even moderate reductions for just 1 week, disrupts blood sugar levels so profoundly that you could be classified as pre-diabetic. Short sleeping increases the likelihood of your coronary arteries being blocked and brittle, setting you on a path toward cardiovascular disease, stroke, and congestive heart failure. And then, fitting Charlotte Bronte's prophetic wisdom that a ruffled mind makes a restless pillow,
Mhm.
disruption further contributes to all major psychiatric conditions, including depression, anxiety, and suicidality. And then he says this is also worth mentioning: the physical and mental impairments caused by one night of bad sleep dwarf those caused by an equivalent absence of food or exercise.
Mhm.
It's difficult to imagine any other state, natural or medically manipulated, that affords a more powerful redressing of physical and mental health at every level of analysis. And then this amazing summary statement, and then I really want to let you run with this. Sleep is the single most effective thing we can do to reset our brain and body health each day. Mother Nature's best effort yet at contra death. So that's a I think a potent summary statement about uh, if we don't get this incredibly precious rest every night, we're heading towards a heap of hurts. And so let's start to unpack this a little bit. And I want to get a couple factors later about how all this relates to many of the signs, and we could say symptoms of aging. That aging, many of
Mhm.
the signs of aging are almost directly proportional to our lack of deep non-REM sleep. So talk to us a little bit about your experience with this, and add whatever data comes to your mind about just encouraging our listeners to really pay homage to the nocturnal imitation, what I often refer to, Nevin, as the natural curfew of the night, that when it's dark, we're invited in, and we should pay attention to this invitation and let nature do its restorative duty.
Well, and yeah, I mean, this is a great summary because the data really is it's overwhelming at this point. Just what lack of sleep, poor sleep, disrupted sleep, what it does to the body, what it does to the mind, and especially when we think about sleep, even just in non-humans, it's a ubiquitous thing, and every animal out there in some way has this period of quiescence at night or sleep at night where it just becomes it's necessary. It's a necessary uh, state that we need, everybody needs, everything needs. But what tends to happen, and when we do these studies and when we see just what the impact of sleep is, we're doing it on humans, and we see this, that the heart struggles, the blood sugar struggles, the mind struggles, Alzheimer's, and not to mention, which we didn't speak about as well, just the effect of the sleeping medication. And really, does this necessarily curtail these things? I would say it's unlikely, especially long term, where actually it's probably doing more harm than good. And how I look at this as a clinician, because obviously this is something that my clients, my patients will talk about, and it really adds into the anxiety regarding sleep. Because I think at this point, most people know how important sleep is, and most people recognize what a good night's sleep can do. Now, the trick or the challenge becomes getting to that knowledge of getting to sleep to now the actual execution of being able to sleep, which is unfortunately easier said than done. And while the evidence is out there about how important sleep is, I guess to take it to another level, and then when I think about as a clinician how to help somebody there, it's almost like all this knowledge, it is power, but that power, it's overpowering us at this point to now where this knowing what sleep doesn't do is not helping anybody sleep better at night. If anything, people are just going to bed with more of a ruffled pillow because these are the things that are going through someone's distressed mind about being unable to sleep.
Let me,
Uh,
let me just interrupt that
yeah,
for just a second, Nevin, because I think that's really super important. And it's also somewhat funny, I mean, humorous in a gallows way, and very ironic that this is what
yeah,
happened to me. I'm reading all these books, and on one level, like, OMG, this is amazing, this data, but on a subtle level, it's like stressing me out, right? Because I'm not.
yeah, yeah. It stresses me out. Yeah, it's really, yeah,
So it's a what the tradition sometimes refer to as a near enemy of this type of data that obviously it can be very helpful in terms of informing us of the importance of sleep, but it can also backfire if we're not getting that sleep, and
yeah,
then it getting fuel to that stress fire that's saying, oh my gosh, here I am, everybody's telling me I should get my sleep, I'm not
yeah.
getting my sleep, and it makes it worse. So let's again, I'm going to let put this ball back in your court. um, how can we then, with your clinical experience, give us some very specific tips, both in terms of, and again, I don't mean to interrupt the track that you were on, but in terms of like sleep hygiene, how to
Sure.
really create very practical, hands-on tips for how to really affect a more powerful sleep.
Yeah, and that is the other good thing that comes with all this knowledge and all this data that's out there, is there is actually a lot of information out there, very very accessible for how do we, what are some of the things we could do to start this path for better sleep. And again, I mean, especially in this Apple age where you just go to Apple News and there's all these different articles there, 7 tips to sleep better or 6 things you can do right away to sleep better. So the information is out there. But what I would say, and before going into some more of these tips, it's about how we relate to this information that I think is just as important as the actual information. Because and I think you may be able to agree with this as well. There's a difference between, I think this is actually a line from the Matrix. There's a difference between knowing the path and walking the path. And I think for a lot of people, we know the path, we know what we need to do to sleep, but now actually doing that becomes challenging. And to as an example of this, I would say the first thing to help with sleeping at night, it actually starts in the daytime, and that is to have a fixed wake up time.
Uh-huh.
Monday, Wednesday, Friday, Sunday, whatever the day it is, the brain, days of the week is something that is a construct that we've created as human beings. But the brain works on this 24 plus hour clock where every day, every cycle should be the same. And that cycle has to start with waking up at the same time every morning. It just becomes paramount, I think, to starting to do everything else that's being talked about to improve sleep, is to have that anchored wake up time in the morning. And then from there, I would actually say a lot of these things we need to do for insomnia start with how we are living our waking life, what we are doing in the sense of the hours of wakefulness that were given to us here. A big part of this, I think, goes back to how we as human beings are living our life now compared to where we were, even just 50 years ago, which in the grand scheme of time is really not that long of a time. We certainly are more sedentary now. We are a little bit more, I don't know, a little bit more, a lot more kind of using technology as part of our daily lives, whether it's with work, whether it's with play, and oftentimes that computer, phone, whatever it is, it's something that's with us all day, and then even what goes more important, even after the sun sets, it stays with us at night. And really, our brain is not wired to have to take in all this information and stimuli over an extended period of time like this. Once upon a time, human beings were living and dying by the sun, and that's something that's kind of become a lost art form now with the advent of technology and the light bulb and the fluorescent lights out there. So, I guess to tackle what you're saying about tips to improve your sleep hygiene, I think there's a lot of great information out there, and it all makes rational sense. Avoid the caffeine too late in the day, avoid taking naps. Make that bed a place where you reserve it only for sleep and intimacy. Um, if you're unable to fall asleep, you're not in your sleep environment. Exercise becoming so paramount of so important to be able to allow your body to be exhausted so that the sleep is able to come deeper at night when your body is recovering. I mean, this all becomes very important. But I've also seen, and you have to take it to the next level. There, I've seen people who can do all these things right. They cut out the caffeine. They don't take naps. They're going to bed when they're sleepy, and the sleep is still elusive to them. And so there has to be a missing piece there to where it's not just some cookie cutter recipe to sleep, but there has to be something else that I think comes into how we're living our waking life to allow when our head hits the pillow, our mind to be at ease, to our mind to be at rest, to allow that ruffled pillow to be one that has more of a smoothness to it. Because I just think insomnia, it's kind of the end result of how our lives are being led now, and essentially what we are taking to bed with us, and what our technology has given to us, which don't get me wrong, is a gift and it's excellent, and in many ways it's made our world a better place. But I would argue that how it's made our lives worse is sleep disorders are increasing, insomnia is increasing, mental health disorders are increasing. I think I was just reading a study about how the suicide rates in young adults have just skyrocketed over the past 10 years here. And while there's no one reason for that, I think we certainly have to look at poor sleep and really how our life as human beings isn't as necessary an organism anymore. It's kind of like this higher level, almost, I hate to say it, but almost like robot type existence that we're living now, to where we're just not using, everything that our body has been given to us like we need to. Our hands, our feet, our legs, our lungs. These are things that have been given to us, and how do we spend it? Oftentimes in a chair doing computer work all day because that's what our job dictates. So when we talk about not sleeping, I think it's a greater phenomenon that we can't ignore how we're living our waking life as well.
That's really terrifically well said, and so important. And I think it's also worth tossing into the mix here, Nevin, that my understanding, and correct me if I'm wrong, is that there's not one psychiatric condition where sleep is not adversely affected. And so the kind of the bidirectionality between
Yeah.
psychiatric disorders and sleep is unequivocal, and also quite disconcerting. And what came to my mind, and I'm curious if you've worked with this, is that when I hear you talking about this, it's very interesting when people we're armed with all this incredible information, which of course is really important. But one of my new maxims these days is, um, uh, you know, information to transformation. In other words, how do we take this data and really apply it? And I think this particular arena is unique in that we're talking about, well, how do I do better sleep? Well, I think one of the initial things right off the bat, and I'd love to hear your thoughts on this, is that, and this is where the stuff really ties into my understanding of meditation as well, is that when we're trying to fall asleep, in a certain sense, what we're trying to do is we're trying to do nothing, but we're trying to do it really well. And that's one of the ways I talk about what meditation is, the art of human being and not human doing. And I think
Yes.
this larger gestalt, this kind of context that you're talking about, is completely applicable here. Is that we've lost the sense of being, and we define ourselves by what we do. And so when we fall asleep, we're basically, it's nature's invitation to get undone or to come undone. And we're so good at doing things, we're not really trained, so to speak, and even that's almost an oxymoron, in the art of not doing. And so, in the inner yoga traditions you may or may not be aware of. It's very interesting. They talk about the subtle winds, and these subtle winds are what actually drive thoughts. And when we fall asleep, we unwind. And what I often talk about in this context is we unwind. And if
Ah,
we're too windy, the mind, in fact, in Vajrayana language, thought is literally referred to as movement of mind, is driven by these winds. And so, to me, and I'd love to hear what you have to say about this. And this is where I have to say personally, my experience with meditation has been the ultimate kind of sleep aid is that it allows me the opportunity to once again, and here's this kind of narrative, this theme for our conversation. It allows me to change my relationship to the contents of my mind, so that when these thoughts arise, instead of setting up the usual adversarial relationship I have with them, that of course keeps me awake and is one way
mhm.
to exacerbate insomnia, I allow myself to kind of step back in this kind of witness awareness mode, a more playful, open relationship, almost celebratory relationship to the windy nature of my mind. And that, in a way, allows me to come undone. That therefore, the natural consequence of that not doing is, in fact, sleep. So I'm curious if that speaks to you, whether you've had some experience with that sort of approach.
No, and that's wonderful. I'm really happy to hear that your experience has changed with meditation, and I don't think it's a coincidence that when we look at these apps that are out there and available to us for sleep to improve sleep, meditation, mindfulness, they're a cornerstone of every single thing because this is the answer. Well, this is part of the answer to be able to sleep is to be able to allow ourselves to be undone at night. Using your words there, it reminds me of that quote. I believe it was Gandhi who actually said, every night when I go to sleep, I die, and then when I awaken in the morning, I'm reborn. And at the
Right.
end of the day, at the end of the night, we have to quote unquote let ourselves die. We have to let the day die. We have to let everything that we are trying to accomplish as human doings into just like you said, a human being. I think that's an excellent analogy. But this just becomes a challenge to be able to let go of these things. And meditation just allows for us to, and I know you can speak to this much better than I can, to allow ourselves to just be in that moment without any judgment or preconceived notions or anxiety regarding what the next things are. Because if we stay in that present moment, really, there's no room for regret. There's no room for anxiety if every moment is being lived by breath to breath. And if we are able to understand this and understand how we can apply this and how we can do this in a way that relates to what anybody can do. I understand, and even in my words, like meditation, it can be challenging for people to figure out, and no one, at least I don't think, figures it out right away. It becomes a practice. It's like any other skill in life. Michael Jordan didn't get to be Michael Jordan by not practicing multiple hours a day at his craft. And that's what, in terms of meditation, I think this becomes a whole mindset that we have to create and cultivate that really kind of goes counter to how how the world is moving nowadays, where really it's just there's no room to kind of just stop and observe the moment because there's just always something going on. There's always some anxiety or worry that we have that just keeps the brain trying to figure it out. And meditation just becomes this beautiful venue to be able to allow, instead of constantly feeling like we need to catch up with the world, to say, this is my time to let the world catch up to me. And lo and behold, people sleep. And I've heard that from, again, not from you and from multiple other people, that if they could just take some deep breaths and stay focused on the being in the present moment, the sleep will come. And there's absolutely something to that. Exactly. So I really appreciate how you say that, and I certainly think some of these Eastern wisdoms, it needs to be applied to this our Western culture now. And I think there is a push, and I think there are some inroads that it is happening, and it's very exciting to see as well because I think this is going to be the way to really start to transform sleep and sleep disorders into something to where we can provide a lot of hope, where it's not just study after study about how horrible not sleeping it is, but now we actually have a way to improve this that goes beyond looking for an answer outside of ourselves with a pill or a behavior that we do into something that's within us and within every human being out there. It's really a beautiful thing to think about and really exciting to talk about.
Yeah, and let me toss in this. I just thought about this when you were
Uh huh.
you comment that on a more metaphysical level, just briefly, it's very interesting that because we are more human doings than human beings, and when we fall asleep, not too dissimilar to when we die, we
Ah,
basically done. And I might hypothesize that part of what could actually be kind of sublimating this entire inability to fall asleep on one level could be fear of death, because
mm-hmm.
we are human doers, and nature's ultimate curfew, which leads uh, really in its deepest kind of sense, in the ultimate curfew of the darkness of death, is nature's restraining order that does not allow us to do anything. And if we identify ourselves as doings and not beings, then I think this is also easily associated with our fear of death. That part of our
Yeah.
ability to let go, and that's what dying, letting go, is a euphemism for death, really. I
Mm-hmm.
think that into what in our nightclub schema we talk about. Then we have this kind of charter of these four so-called nocturnal practices, lucid dreaming being the platform, just to give you some sense, which can mature into what's called dream yoga, can mature into sleep yoga, which itself can mature into Bardo yoga, which is Bardo, of course, the teachings in relationship to death. So I think that's worth tossing into the mix. But
Absolutely.
get more practical here, because this is where your expertise comes into play. I know in my own practice, I'm a member of the American Academy of Sleep Medicine. I work
Uh-huh.
principally the second most common sleep disorder that you very well know, which is obstructive sleep apnea. But it's interesting. I often, in my own clinical practice, when people come in, they have an intractable chronic infection, something's not healing. We put them on the big gun antibiotics and not resolving. One of my go-to questions right now is, "How is your sleep?"
Mm-hmm.
And I often find that you could say, prescribe sleep. And the reason I toss this into the mix is that in addition to prescribing sleep, and I'm becoming a little bit more courageous with that, especially because I live and work in Boulder, where I'm now in conjunction of prescribing sleep, I'm prescribing meditation, things like mindfulness-based stress reduction, things that aren't associated with any kind of religion. Do you do that in your practice as well? I mean, do you prescribe meditation? Is that part of your armamentarium?
It's certainly something that I will speak of, and it's something that I will really, really emphasize. I guess in terms of prescribing it, that's like I certainly don't write it on my script and be like meditation 3 times a day and hand it to them. But it is something where I say like this is going to be a big part about what we speak about in the future. And I work, and I know you've had her on fairly recently, Dr. Kristen Lamarca. She's my
Yeah,
colleague in San Diego, and we work very closely together here. And I will very much refer to her for a lot of the insomnia patients, to where we do need to take it a step further. This is something to where you know people are able to know what to do, but they need a little bit more help and guidance, or they want to help cultivate this practice of being able to improve their abilities to relax and to do things like what we call biofeedback, where we actually are becoming more aware of our what's called autonomic nervous system, our heartbeat and our breath, and actually able to visualize and see what relaxation looks like on a fundamental physical level in terms of our breathing and our heart rate. So, in terms of prescribing meditation, I certainly don't,
right.
write it on a piece of paper to do it, but I will certainly say how important it is and try to get people into the right venue to be able to speak to and create a relationship with someone who can really really take it from what I can put out there into now executing this on a deeper level and a more tangible level. So I like how you say that though, prescribing a meditation, because I say it out loud and it's like, well, why don't I do that? Because that sounds like a great idea, and it sounds like something that could really be low risk, potentially high benefit. So I might have to take that away from here and actually try it out on some lucky candidates.
Yeah, part of this came into my mind. I was recently rewatching. I'm sure you've seen it, the National Geographic thing on Sleepless in America, and I'll put that link onto our site for our listeners.
Uh-huh.
The 90-minute riff on exactly the topics we're talking about, and they're interviewing all these poor people that are suffering from sleep disorders, principally insomnia. And as I hear one after another, and of course I hear this in my own practice as well, I realize, if they simply had the skill set of relating to their mind, in a way that meditation invites, so much of what they're struggling with can be obtunded, alleviated by, again, altering one's relationship, to the contents of one's mind. But let's talk, if you don't mind, for a second, Evan, about sleep medications,
Yeah.
Ambien, Lysta, and the like, and whether they have a role at all in your clinical practice, what your relationship with those is, because as I think we both well know, they have a pretty powerful shadow component, and they can cause a lot of collateral damage. So talk to us a little bit about the role, if any, of sleep meds for people who really get desperate in terms of trying
No,
to get the.
well, and absolutely, and it's such an important topic, and it's a topic in and of itself. And I would say, me being as an MD, this really is what I guess can set me apart from non MDs is my ability to prescribe medications. And I guess the irony that comes with that is I'm not a big medication, how you say, pusher. I really don't prescribe medications too often. Now, to answer your question though, there is a role for sleeping medication. I really don't want to poo-poo that sleeping medications have no role and they're nothing but doom and gloom, because there is a role with sleeping medications. It's what I think the best chance we have to potentially improve insomnia within the first night, within an immediate relief of insomnia. Whether this is a very restorative sleep or a very significant increase in sleep is up for debate. But sleeping medications are maybe not necessary, but they certainly should be part of the treatment plan, especially since everything that we're talking about here, and even some things we're not talking about. I mean, this is hard work. This is a transformation of a way of someone's thinking during their waking life and how they're approaching sleep and their relationship with the bed. And this is not things that are easy to do. When typically people with chronic insomnia, they've had this for at least 3 months. The diagnostic criteria is at least 3 months for 3 nights a week. But oftentimes people with insomnia, they've had this for years, decades, after the birth of their first child, after that divorce, they've just been struggling with it for years. And a medication is certainly something that can hopefully, how I tell patients, put a band aid over that wound of insomnia so we don't have to look at it every night. But we have to recognize that these band aids aren't going to heal that wound. These band aids, in the best case scenario, will cover it up so we can at least be in a better position to sleep at night. But with covering that wound, the hope is that we can start to do things to heal that wound. And healing that wound of insomnia really becomes everything else that we're talking about. And it is going to take time. And sometimes that wound is really vicious and festering, and it hurts. So there is a role for these band aids nowadays. But like I said, we have to remember band aids don't heal, and band aids hurt to rip off. It becomes very challenging once we get on sleeping medication, especially taking them nightly and chronically, to now all of a sudden take that away. The brain doesn't like that. The brain is not able to overcome the lack of that medication there when it becomes something that's it's been subjected to every night. And if we are going to do things to heal that wound and to make that wound smaller, we have to be able to use medications for what they are, as a temporary solution to a chronic problem. So, and with the sleeping medications, there are numerous sleeping medications out there. And there's a lot of medications that are not oftentimes not indicated for sleep, but used because they have a sedative property to it. And I have to say, I do. While I don't necessarily go to medications first line, I do. I would be doing patients a disservice if this wasn't at least part of something we talked about and something that we don't offer. But with the medication, we have to put it in the context of the greater global picture here. So I guess it's a long-winded say of yes, sleeping medications, there is a role for it, but I think the role that it has, it just becomes too easy to write a medication now without really examining everything else that we're talking about here, that just becomes so important to be able to conquer the insomnia long term.
Yeah, exactly. And what you're saying here brings to mind, I have to say my mind is open around this sort of stuff as well, Nevin, because again, in a larger kind of philosophical way, I find it very interesting to see how both the so-called East and West fall into these kind of reductionistic traps where, for instance, in my sort of area of expertise, you could kind of associate that with Eastern approaches. It's very easy from that stance to poo-poo medication, sleep aids, and the like. And fall into this kind of reductionist approach that, oh, my medication alone can do this, my whatever can do this. But and obviously in a converse way, the same thing happens in the West, where they may be a little bit more blind to their own forms of reductionism, that everything can be handled with medications and the like. And so one of my favorite approaches these days, you may have heard, the integral theory. I'm a big fan of that approach, where there are, in this specific case, and this is why I brought it up, there are, in fact, obviously, neurological correlates to phenomenological states of mind. In other words, when you're sleeping, your brain is in a certain state.
Hmm.
And if you can bring about that kind of bidirectional means, in other words, if you can work with the substrate, the so-called physical substrate, in this case, the brain, with these sleep medications, then obviously with that larger view and honoring the more integral approach, these meds do have their place. So let
Hmm.
me ask you this. Is there anything outside of medication that can target these neural correlates? Are there transcranial devices or other types of approaches, even on the forefront, if you're throwing your javelin into the future? Do you see any hope with technology to assist bringing about these neurological states, to invoke phenomenological states? Do you see anything outside of meds in the future that could potentially be of benefit to people?
Yeah, absolutely. And there are some things that are actually out there that are non-medication that kind of work exactly what you're saying from kind of a neurological point of view. I'm trying to look it up now because there is I'm just trying to look at what it's called. There's actually I'm not trying to plug anything here, but I was just reading actually about this new device that's come out. It's called Cervella, and essentially it uses electrical impulses through your ears, through your temporal area there, to actually slow down brainwaves and actually be able to entrain more of a rhythm that is more conducive to sleep. This technology has actually been around for quite some time, but it's now just becoming to the forefront of being able to be more on the consumer markets. So there is absolutely ways that beyond medications and maybe from a neurological point of view or just slowing down brainwave point of view, quote unquote, to be able to improve insomnia, without drugs and potentially in a more natural way. And again, like I said, what we really want is a durable benefit, a benefit that could be long lasting, that we can take with us from age 16 to 60, something that will work throughout the course of our adult lives where, insomnia is going to be a part of life. It's just a natural order of things. There are going to be nights we can't sleep. There are going to be nights where things happen in our waking life and it just comes to bed with us. And we can't necessarily force that sleep to happen when the brain needs to sort through a significant trauma or life change or event to where that sleep wake balance is going to be shifted toward being awake because it needs to figure it out. So, what I would say is that the sleeping medications are excellent for that type of insomnia, this transient insomnia to where we have a reason for not sleeping, and it's hopefully something that can be temporary, and we have a hypnotic aid to help with that. But in terms of what you're saying, are there other things beyond meds? I do think there are some technology based things out there. I think there is some utility to a lot of these apps that are out there that just have guided meditation that kind of do, you know, everything that we're talking about, but more in a practical way. So yeah, again, just a long-winded way of saying yes, there are things out there. I think it's very exciting, and the with all this technology we have, it's a gift and it's a curse. And I really hope that in the future we can harness this incredible gift that we've been able to have as human beings into something that's going to help our species as a whole, and to be able to get back to where we were when it's when we were first just on this world, where sleep was something that was just part of our daily life. And I think if we can get back to that, a lot of our things are going to be there. It's very easy to talk about the downside of not sleeping, but the opposite is true as well. The upside of it, like once we can start to transform it and begin to sleep better, my goodness, it's really, really rewarding and gratifying to see just how lives can change just by simply improving something that's already built into who we are. It's already ingrained since we were born, what we were able to do. And to be able to get that back, it shouldn't necessarily have to take a lot of pharmacology. It shouldn't have to take a lot of increased or a lot of technical things. It's oftentimes just kind of going back to what our mind was like when we were kids, because that's typically when we sleep the best is when we were children. When the world was new, when everything was exciting, and it was a simpler place. So
Yeah,
yeah,
we return yet again, and I think it's worth returning to it because it's I think a powerful narrative. Is that on one level, the process of sleep is so simple that it's that children, I would argue, because they don't yet identify themselves so much as human doers, right? More
yeah,
spontaneous,
yeah,
more playful. Then a natural we can let them teach us a natural consequence of playful
yeah,
relation. Like, hey, what a beautiful, simple relationship they have to life, and look how beautiful they sleep. And here we are, so-called sophisticated adults, all stressed out with our complexities.
yeah.
And the natural consequence of that, unfortunately, is a very complex relationship to sleep. And I would argue that I think this is one of the reasons these really simplistic methods are, until the science comes up to really back them, they're challenged by the Western complex mind, because really, can it be that easy? Well, yeah, I think it actually can be that easy. So
Yeah.
we have to kind of circle back around by using complex science to show us that fundamentally the simplest approach is actually the best. And I find that really a painful irony, and also somewhat encouraging that with all the research that's coming out and with all the studies and the power of science, that eventually we can reinstate the utter simplicity, and in a certain way let that simplicity, you could say, defeat the complex modern mind. So I find that an interesting,
Absolutely.
don't you
Yeah,
think?
yeah. No, I'm 100%. I mean, because yeah, at the end of the day, sleep shouldn't be rocket science. It shouldn't be something that needs technology. It shouldn't be something that has a lot of preparation for it. Sleep should be as simple as waking up. It's our biological rhythm to sleep. I just think in culture now, and maybe this is more Western culture, we try to go against that grain a little bit more. We try to go to against what our own biological drives are. Whether it's that let's binge watch that series on Netflix, or let's see what's on the 24/7 news cycle now, or what Twitter is saying. Like, we kind of go against that biological drive that we have to sleep. And maybe it is just as simple as disconnect from all these things, simplify the burdens on your mind. Go back and be out in the sun more, be one with nature more, and I think the sleep will follow. I think for a lot of this, people are trying to improve their sleep right away, which can take some time and can be frustrating when that's not happening. So maybe the paradigm to follow is, what are some of the things we could do in our waking life? What are some of these things that we could do when our brain is actually awake and alert, to put ourselves in a better chance of sleep at night? And I think if we start doing that, the sleep will follow. The brain will figure this out, in some respect, if we just live our waking life in a way to where we give sleep that respect, and we are able to live our life in a way that is more lucid. And it brings to mind this concept of, and I know you're very familiar with this, beginner's mind. And I think this just is applicable to how children live their life. We have to go back to taking each day for what it is, as a new experience and a new opportunity to do things better, instead of the preconceived notions and the conclusions we've made based on how things were in the past. And that's how it always will be.
Yeah, beautiful. And then, one thing that you mentioned here that I think is worth unpacking, Nevin, is actually the role of light in
Yeah.
sleep. That, two things I want to address here that I'd love to hear your feedback on, is that how important it is to actually dose light during the day, so that we kind of, I would say, my language, reinforce the natural circadian patterns. We kind
That's
of
right.
dose on light during the day, and then when the natural curfew of darkness comes in, we start to titrate away from that dosage, so to speak. And
Yep.
so two things here. One is reinforcing the importance of dosing with light before we go to sleep, and then also on the other end, the extraordinarily subversive, insidious aspects, deleterious aspects of light pollution, artificial light, and how damaging that is. And again, brief kind of philosophical interjection, I have argued that one of the signatures for what's referred to as the Dark Age, according to Hinduism, what's called the Kali Yuga, Buddhism has the same tenet. We're living in the Dark Age. And I think one of the signatures of the Dark Age, two things. One is the epidemic of distraction. That's one of the signatures of
Mhm.
Dark age because it's so subversive. And secondly, the dark age is also, and this completely relates to the to distraction. Just look at your tablets and whatnot, your phone. Is how the dark age is defined also by excessive light, and how
Yeah.
light pollution is really causing some serious ecological devastation. That because again it's so quiet, it's a little bit like global warming on an
Mhm.
even more insidious level. There's a heap of hurt going on in the ecosphere based on this runaway epidemic of light and our addiction to it.
Yeah, yeah, and it kind of goes with what I said. The first thing we could do in insomnia is to have that fixed wake up time, because going with this fixed wake up time, the hope is that we are getting this light. This is the time to get the light, to tell our brain that this is the time to be awake, to start regulating our circadian rhythm, to fix this wake up time by starting it with light. And the opposite is true as well. When the sun sets, this is the signal for our brain to make what's called melatonin. Melatonin is made by our brain every night. It's the signal that it's time to sleep, that the wakefulness drive needs to be reduced. What tends to happen now, and you touched on this, is light becomes 24/7. It's not something where we are doing a good job of reducing the amount of light in our eyes. And certainly we can take high doses of melatonin, we can put these blue blocker glasses on, and do things to kind of do a harm reduction with the light. But at the end of the day, our relationship with light is what needs to change. We need to recognize that the world isn't giving us light right now, and we need to be one with the world and not go counter to that with all this extra light here. I mean, it's just so it's so obvious, but it is used to our enemy there. This the great example, the city of Las Vegas, the city that never sleeps. Well, that's New York, I guess, but I would say Las Vegas is the same way, in the sense to where it is light just constantly there, and there is no perception of time in these places, and this does tend to cause a lot more problems. And for a city like Las Vegas, this lack of sleep, it is going to increase impulsivity. It is going to keep people spending their money there. It almost is. It's a part of our own demise, I would say, as well, because we know, and all this knowledge we have about sleep and what it does mentally, it can be used against us in very, I would say, nefarious ways, but also in the way that we can also, if we can understand it, begin to make changes with that as well. And so, talking about light, it's extremely important, and probably right there, number two. And what are the things that we could do to help with getting a better night's sleep and to have a more fulfilling life, is to think about what the world is giving us at a specific time of day, and to roll with that a little bit. And when the world isn't giving us that, let's do things to go back to what the rest of the animal kingdom is doing, and not keep creating all this artificial light that just keeps the brain wired, keeps the brain going, and lo and behold, insomnia becomes this human condition that we've done to ourselves.
Absolutely. Yeah. It's interesting how, again, if we were to do a Google search on our conversation, Nevin, it's very interesting how often this term relationship comes up. We've talked about relationship to thoughts, to the contents of
Yeah.
mind, relationship to technology, relationship to light. And I think I'm putting an exclamation point on this because what this therefore does is it empowers us. We're not unwitting victims of technology, of light, of thought. We're unwitting victims of an inappropriate relationship to these
Yeah.
phenomena. So
Yeah.
the reason it's important is because this is something we can, so to speak, do. If you want to talk about doing, well, we can do a more appropriate relationship to light, technology, thought. And this again is why, to me, the power of some type of introspective technology, meditation, whatever you want to call it,
Mhm.
is really about altering relationships. And therefore, that by altering relationships, we empower our capacities to handle these otherwise adverse situations. And so I think it's very compelling that
Yeah.
that's one of the themes we keep circumambulating here.
Yeah, yeah, and I'm so glad you say that as well, because it is about the relationship. It's about the relationship we have with sleep, the relationship we have with all the aspects of our waking life, the work we do, the personal relationships we have. That all these things are things that feed into wakefulness and feed into sleep, and just altering a relationship, just like you said. I mean, that can make all the difference in the world. And yeah, it's just really exciting to think about. If we can alter that relationship with sleep and just start to understand it more and achieve it more, the reversal of all these things that show lack of sleep gets. We are having our heart thanking us. We are increasing our productivity. Our mood improves. I mean, all that negative studies come out about the lack of sleep. I think we could flip this around on its head and talk about all the positive things that can come when we start to manifest changes in that relationship. And it's a really beautiful thing. And it's probably one of the other things I like to tell patients about when they just come in bombarded by all this data. Like, let's look at the other side of the coin, because if this is all true, then the opposite is true as well. So, what can we do to now go on the other side of the coin and improve this instead of getting bogged down by all these potential things that could happen if the loop of our life doesn't change?
Exactly. Yeah, that's really well said. And what I thought about here is that really we can reverse the problem by reversing the relationship, and that's
Yeah.
really one of the central narratives here. So let's come back just a couple more practical things here in terms of
Yeah.
light. And I want to circle back to melatonin. So give us a couple of specific tips, Nevin, if you would, about not only dosing during the day with light, but obviously, and this is an interesting kind of play on the red light district, right?
Uh-huh.
So
Uh-huh.
when we go to sleep, as all the blue light, especially from tablets, suppresses the release of melatonin, and so when we go to sleep, we can enter the kind of red light district of the mind, right, where we're
Hmm.
trying to
Hmm. Hmm.
tone down this stuff. So talk to us specifically about. I think I read something or heard something like 40 to maybe even up to 60% of people these days, their intimate sleeping partner is their device. They go to sleep with that. They go to sleep with whatever. Um, Give us some parameters about kind of detoxifying from this light. Like, how early in the evening should we pull away from our tablets or computers, and be very, a little bit more specific about our relationship to light, and backing away from it, honoring this natural curfew that light otherwise just
Yeah.
interrupts.
Yeah. Well, and I think I touched on this as well, but to go beyond that, when we look at these articles and when they talk about quote unquote sleep hygiene, we're typically saying 1 to 2 hours before bedtime, shut off the lights. And I think that's a reasonable thing to do. In my experience, or in my, how I relay it, is I actually start this process where I'm saying, beginning at sunset, start to think about the relationship with light, start to think about what are we doing in terms of all the light we're getting into our eyes. Where sunset is probably a little bit on the early side to, put all the lights away. But I think that's the time to begin to start thinking about shutting off those lights and to start thinking about, okay, what can I hold off until tomorrow? What can I compartmentalize that I really need to take this to bed with me? Do I really need to read this article or play this game at night here when I'm going to have another chance to do that tomorrow when the world is giving me light? So what I would say is 1 to 2 hours is probably good, but if we can start even before then, even I would say 3 to 4 hours before bedtime, this becomes really important. And there actually is, and I'm not, you may be aware of this, there actually is a push, and especially in California here, where high schools are going to start later because
Mm.
biologically it's been shown that the teenage mind is not is not a 10 to 6 sleeper. The teenage mind is more of a night owl sleeper, and it's not their fault. It's not laziness. This is their own circadian rhythm not maturing and advancing to where we are typically as adults. They are just natural night owls. So in terms of using light to our advantage here, we do want to do that during the daytime here, but we certainly don't want to give ourselves light too early in the morning to where our own biological clock is not ready to wake up yet. So that becomes the other part of this in treating a circadian rhythm disorder, like a natural night owl or someone who has morning tendencies, to use light to our advantage, but not necessarily overflood ourselves with light to the point to where our own biological rhythm is now getting confused. And melatonin, just to speak on that a little bit there, it is a naturally occurring hormone that our brain makes every night, that helps to entrain our circadian rhythm so that we do sleep. Our brain doesn't make a lot of melatonin at night. There isn't a high dose of melatonin that's needed to perform this task. It's easy nowadays for people to take very high dosages of melatonin because they don't want to take a sleeping aid or because they think it's natural. And studies are pretty inconsistent on whether that's even going to do anything to induce sleep or improve insomnia. The real trick with melatonin is actually in improving circadian rhythm disorders to try to get people's body clock shifted a little bit. And this is why it's also used for jet lag as well. Melatonin has a lot of usages there, but the issue with melatonin is it is a naturally occurring hormone that our brain makes. So we shouldn't necessarily need to dose ourselves with a lot of melatonin. And in the melatonin, I'll call it industry here, I mean, it is a supplement. It's just like any other supplement out there where there isn't as much oversight or regulation compared to the pharmaceutical industry. So there's hundreds of brands of melatonin out there, and it's hard to actually know what we are actually getting from that as well. I would say what I talk about with melatonin, and one thing that can help a specific subset of people, is to take a very low dose of melatonin. And when I say low dose, maybe 1 milligram, 2 milligrams max, and you take that at sunset. You don't take it like it's a sleeping medication. You take melatonin at a time when your brain is supposed to be starting to make its own melatonin. And that in and of itself can hopefully psychologically get people to understand that, okay, I took this dose of melatonin here and it's sunset. And then in and of that self, hopefully they're able to do a better job of backing off on the light or being able to end their days. And even if we use melatonin like a quote unquote placebo, the placebo effect is real. Every study that we've done on drugs and things, it shows that people respond to a placebo. And while that's interesting in and of itself, I think this is information that we could use to our advantage. Just the fact that people take something that's relatively safe and naturally made, if this can transform their insomnia, I mean, it's like that phrase, whatever helps you sleep at night. That answer to sleep is different for so many people. And we just kind of have to find our own way with that there. And sometimes we need to use these little tricks on our mind there, even if it is a placebo effect, just to kind of structure our day and night a little bit better, to where light is something that we are more cognizant of and something that we are more aware of, and what role that might be doing in kind of perseverating the loop of insomnia that we have.
Yeah, that's so interesting. I mean, a couple of things came to mind, and I'm a big student. I love studying placebo and nocebo effects because, in fact, as you know, it literally is the most reliable effect in medicine. And when we talk about, really, it's amazing. It should not be underestimated. And that when the reason I bring this up is when we're talking about placebo, it's really placebo effect is a slight misnomer, is it not? Because it's really a
Mhm.
mind effect. And to
Yes.
me, here
Yes.
we're coming again back into this. Well, what do you mean mind effect? Well, it's a relationship effect. It's like how are you going to imbue whatever it is, whatever the placebo is, with your belief structures, with whatever you do to empower the placebo to have this kind of medicinal effect. And so the other thing you said at the outset, kind of again a slightly philosophical interjection about our relationship to light, I have found it interesting, Nevin, to explore how our relationship to light is revelatory to our relationship to darkness altogether. And that is, how afraid are we of literal and metaphorical darkness? How afraid are we of the unconscious mind, of death, of all these
Yeah.
hide out? Because it's very interesting. To me, it's really unfair to darkness because darkness is in and of itself a so-called very neutral event. But what we do
Yep.
in the light of day is we throw darkness is the most convenient refuse heap for all our refused experience. It's where we toss what we don't want to face into the darkness, fundamentally the
Hmm.
unconscious
Hmm.
mind, and conflate with the darkness of the night. And so I think this is worth tossing into the mix because when people really have again, adverse or untoward relationships to darkness, this could be revelatory of how they have this relationship to the contents of their own mind and heart. And I think a metric for this is like, how many lights do you leave on when you go to sleep at night?
Yeah.
How comfortable are you being in complete darkness? What happens when all outward bound strategies are taken away from you? And again, this is, I think, another intimation of our fear of death. How fundamentally comfortable are you being completely with yourself without distraction? And I think I mention this
Yeah.
because to me, this comes down to a very powerful kind of bed of these pathological issues that so many people face. And so I wanted to toss that back into the mix because, again, the wonderful conjoining of inner and outer and playing with light and darkness in both a literal and metaphorical sense. So,
Yeah, no, I love that analogy. Darkness, and in terms of how that translates into a fear of death, and you hit the nail on the head. There's nothing inherently different when the light is on, when the light is off. All that's changed is our sensory input. Our sense of vision is blunted, so we are confronted more with our other senses and our other thoughts that are just more present in the dark when our eyes aren't able to look at what is around us there. And we see that with children as well, where children have, that fear of the dark. But how to transform that is to just show that, the light is on, the light is off, and nothing has changed. It's just your experience of what around you that has changed there. And if we are just able to redefine that experience of the darkness, and again, I just love the I'll call it a leap, even though I don't think it's that tremendous of a leap in terms of a fear of death, because when you talk about darkness, it is that lack of sensation of sight there, which, and when we die, our senses slowly start to shut down, or not slowly, but our senses shut down. And darkness and that lack of sight, I mean, it becomes that as well. But what also happens with that is our other senses become more in tune when we lose a sense of something else. When we lose a sense of sight, the sense of hearing can become more astute. And I think that's why people tend to be a little bit more hyper aware of sounds in the night, or things seem to be a little bit louder during the night, because the part of our brain that's responsible for relaying sensory information, the thalamus, it becomes more hyper focused on the other senses that are there. It's like, I would say that's a sense of taste as well, to where if someone is in the Sahara desert for a week at the time, and they drink water, I mean, that is the best tasting water they've ever had, compared to someone who's having water every night. The water is the same independent of that, but it's our perception of it, that lack of the indulgence in that all of a sudden the experience in the brain makes it seem like it's something that it's much greater than it is. And I think that works in the negative way, in the absence of light, but even in a positive way, when we deprive ourselves of something for so long and then we go back to it, it has, our relationship with it kind of goes back to, oh, this is what it was like, this is what the first time I had ice cream was like, or the first time I had that amazing for whatever it is. And it just kind of takes it a step further of being more aware of these things, and recognizing that a lot of these things, a lot of these issues, they're obstacles that we've kind of put up to ourselves. But going back to what you do and what you're doing here with the nightclub and just your own practices, this is where meditation and just becoming more one with the mind and understanding it, I mean, this is the key, I think, to so many different struggles that we have as human beings, even
Yeah, that
beyond insomnia.
we were more everything, my friend. And to me, what I was running, excuse me, running through my head is that in the Buddhist tradition, they refer to mind as the sixth sense, outside of our
Mm.
classic five sensory faculties. And to me, and again, this will resonate with anybody who sleeps, is that when we lie down, senses one through five, sight, sound, smell, taste, touch, they kind of lie down with us. But what
Mhm.
what stands up when those senses stand down or lie down, of course, is the sixth sense of the mind. And so your beautiful summary statement there is, if we can again establish a new, more sensitive relationship to the mind when we're sleeping and dreaming, because especially in the dream state,
Yeah.
mind becomes reality. And why? Well, take a look, because there's nothing else, right? And so to me, Nevin, this is why I talk about these nocturnal practices, in fact, as practices, as not as meditations, is the natural curfew of the night shuts down senses one through five, opens the gates to the sixth sense of the mind,
Hmm.
therefore invites, and really at death almost commands, according to Tibetan teachings, a relationship to the contents of mind, because there's simply nothing else. And if you understand that invitation, then you can align yourself to it and say, okay, now, outward bound strategies are done. Now we're being invited, and eventually you could say forced, to inward bound strategies. And so if we understand this larger context and framework, then we can surrender to that, so to speak,
Yes. Yeah.
and explore that in a really skillful way, instead of establishing the usual kind of wake centric, sight centric, adversarial relationship. And I think
Yeah.
just that alone is enormous.
It is. Yeah. If we understand something, there's no room to fear it. And I think that becomes just like we've talked about, fear really can kind of keep that cycle moving here. And understanding it is really the first step toward extinguishing that fear. And with that lack of fear, sleep will follow. And these beautiful experiences that people have that come to them every night in REM sleep, the dreams, they really can be transformed into something that, we take with us, beyond life. It's something that we take to our deathbed. And it's just really a beautiful framework of thinking about it. And like I've said, there's no harm in this. There's harm in medications, there's harm in a lot of interventions, but in terms of this, the worst what, and I, if you want to even call it the worst, is a poor night of sleep, which most people are professionals at now. But if this poor night of sleep can lead to a transformative experience, or to now a building block to starting getting better night's sleep, my goodness, that's essentially all I want for as a clinician, is to be able to help people sleep better, whether that is with a medication, with a CPAP device, with an oral appliance, which I know you do a little bit of, and or even just mentally perceiving things in a different way, to where sleep is something that is a little bit more effortless.
Yeah, exactly. And this is a really great place to start to wind down our conversation. Speaking of unwinding,
Oh
so
yeah.
let us know how people can get in contact with you. Do you do things like teleconferencing or Skype consultations? Tell us a little bit about you, how people can get in contact with you, because one of the charters of our little nightclub kind of facility is cross-pollinating and introducing people to each other so that they can have resources in this kind of vast spectrum of the materials that were presented here. So let's close by giving you the platform to tell a little bit how people can do what's available for our listeners if they want to tap into your skills a little bit more directly.
Yeah. So, well, and I guess that's a great way to end it here. Well, so I am, as we've talked about at the outset here, I'm a board certified physician in psychiatry and sleep medicine. I am an MD. My main work is really clinical sleep medicine, and I do practice in the state of California. I practice in San Diego. I travel to Northern California, work at a sleep lab up there as well. And this is the primary scope of my practice, is actually more clinical work. And I tend to see, or I do see, patients in a clinical setting. In terms of, teleconferencing and Skype, this isn't necessarily anything that I am offering directly, and for numerous reasons, mostly in the sense of the clinical work that I'm doing. I just stay focused on that. And um, so really, I would say the best way to get in touch with me is really in a clinical setting. I am licensed in the state of California, so I see patients in this state. But my practice in San Diego, as I mentioned, is with Dr. Lamarca, who's been on this podcast before, and has just excellent insights, and could really take the lucid dreaming aspect to another level. So our website, which she may have shared as well during her there, is luciditysleeppsych.com. That is our clinical practice there. Dr. Lamarca has her own site where she does a lot of the Skype and teleconferencing in the scope of lucid dreaming. But in terms of getting in touch with me, again, I am a primary MD. That is the focus of my practice. I certainly very much enjoy speaking in this venue here, but most of the work that I'm doing, or all the work I'm doing, is really in a clinical setting, treating sleep disorders in the California area. I hope that
Sure.
helps.
Yeah, no, that's terrific. And I want to thank you not only for taking the time to chat with us, but also to indulge some of these more philosophical, metaphysical interjections that I threw your way. Because what I try to do is I try to create larger frameworks and context so that we can empower the type of work that you do, so that we have a larger scope, situational scope, contextual scope of what we're really doing here, where especially for some of our peeps, it can maybe resonate them with them a little bit more. But Nevin, thank you so much for taking the
Yeah.
time to
No,
really.
absolutely. Yeah, Andrew, I really appreciate what you're doing with this. I think this is excellent. I thoroughly enjoyed myself speaking to you here. And I really hope that this can reach your viewers, and we can, begin to, really start to improve this further. So really excellent. I really love what you're doing here. Kudos to you. And yes, very enjoable. Thank you so much for having me.
You're very welcome. And as you know, we could probably spend 50 hours
Yeah,
chatting. We'll
I
have you
could, I
again.
could talk about this all day. Yeah.
We'll bring you back on in about a year or so, because really there's so much to talk in this arena. But
There is. I know we just scratched the surface. Yeah. Wonderful.
absolutely. Thanks again for taking the time, and we'll definitely stay in touch in the near future. So appreciate it. Take care
Thank you,
now.
Andrew. Thank you. We'll talk soon.